he is back with us. Dr. Joe Condrini, Sports Medicine Center, Akron Children's Hospital, on board with us. Joe, thank you, my friend, calling in. Good to have you back. What do you have for us today?
Ray, good to talk to you. And one of the effects of this little blast of winter weather we've had the last couple of weeks, I saw the evidence of that yesterday. Pretty busy orthopedic clinic and sports medicine clinic. Kids finally, we've had a couple of winters in a row that haven't had all that much opportunity to get out and play in the snow and winter weather. And in the last few weeks, I think kids took to the sled riding hills and the boogie boards out, and kids were playing outside. And unfortunately, guess what happened? A lot of kids ended up with falls and fractures, and so our clinic was very busy yesterday, a line of people, particularly with one of the most common injuries. And there have been a few changes in the last 5 years in this fracture, so I wanted to talk about it a little bit today. The number one most common fracture, we've talked about this before a lot related to sports, is the collarbone, the clavicle. But number two is the distal radius, and that is the bone in the forearm that goes down to about the wrist. And so many kids who fall on an outstretched hand, so many stories of kids boogie boarding or sled riding, they fall on an outstretched hand and they will get a fracture in the wrist. And so this is a long-time injury in an orthopedic clinic, and it's particularly different in kids between the ages of about 8 and 14 or 15 when they have open growth plates. They're real prone to having these fractures, and they're kind of slightly different types of fractures that they get in the growth plate. And so a little bit of a new approach. So I walked down the hall yesterday to kind of one of the resident experts in town. Dr. Bill Schrader is one of my orthopedic partners who's been around about as long as I have, 35 years or so. Kind of interesting. We both we were at Notre Dame at the same time together, and Bill's had just a great practice of caring for kids with fractures and giving good care in town. And a few of the changes with this wrist fracture, Ray, is number one, when these kids have fractures on maybe one side of the growth plate, or what's called a buckle fracture, where the bone buckles around the growth plate instead of fractures all the way through, we've really gotten away from now, in many cases, our orthopedic partners really are suggesting even getting away from casting these kids, which is really, wow, that's a big step. And sometimes they don't even bring them back to re-x-ray them afterwards. And these kids can get back to sports in 2 to 3 weeks, which is a shorter period of time than it used to be. Now, the other thing is, though, it's real important to know the difference. And one of the ones that I had that I was talking to Dr. Schrader about yesterday was both sides of the growth plate. This was through the growth plate. That's a more serious fracture. That still needs a cast. Or if it's a kid who's going to be pretty reliable, one of these newer splints that's going to keep them from moving that wrist for about 4 weeks, and 4 to 6 weeks usually out of sports, unfortunately, for those kids. But some of these other fractures that are a little bit less involved, we've gotten away from even casting them fully. But still, if you have a kid who has really localized pain after a fall from that, knowing the difference of what kind of fracture it is really important, and getting into somebody and getting an evaluation of it is important. And the only way to really know is with an x-ray as to the extent of the fracture. Now, one thing that's different that we wanted to point out for sure is once kids get past the growth plate years of 14 or 15, they fracture the wrist sometimes in other places, and a bone we've talked about on this show before called the scaphoid or the navicular is a small bone in the wrist that has a really bad healing rate. And so kids ignore this during sports seasons, and they don't tell anybody, and they think it's a sprain, and they don't get in to get that x-ray, and then it gets x-rayed 2 months or 3 months or 4 months later, and it didn't heal. And this, when it doesn't heal, it needs surgery, and it can be a big deal, and it can leave you with a stiff wrist. And so when kids are past that growth plate age, there's a different kind of fracture. But if kids have localized pain for a few days after a fall directly on an outstretched hand, that's the kind of injury. And we finally got some kids who got the chance some of my grandkids even got a chance to get out on the slopes and enjoy some of that snow and ice and running around a little bit. We've had a couple mild winters the last few years where we haven't had as much sled riding, and it was just kind of interesting to see so many kids in the orthopedic and sports medicine clinic yesterday.
Yeah, my twins, Joe, they did a lot of sled riding the last couple of weeks. I can't tell you how much they've been complaining about muscle soreness and bone soreness for sure. They've had the same results.
Ray, I have one more question for you.
Sure.
Just because you're always the voice of reason, and I'm just not sure where I fall on this issue. I actually was, covering a hot basketball game last night in a hot gym, the Walsh Hoban game, and a lot of people there. And, the college games are getting to be bigger and all that. And this incredibly wonderful player, Caitlin Clark, over the weekend. If you haven't gotten to see her, what a phenom, and she's setting all the records in women's basketball, plays for the University of Iowa, was at Ohio State in a full arena, pretty sold out, and it went into overtime. And what do you think about court storming? The controversies come up again, and I'm a little torn on that issue. I mean, there's just so much joy in for the kids in high school and college, and it's a game that comes down to the last second, and the kids can't help themselves when they get out there on the court. But then a lot of the coaches and other people talking about the worry that a player's going to get injured. Somebody inadvertently ran into this player, Caitlin Clark. They're talking about fines for kids who run out on the court and things like that, maybe some hefty fines. What do you think about the court storming, Ray?
I've never been a big fan of it, to be quite honest. And I go back to the days, Joe, when I was doing the LeBron James games at St. Vincent St. Mary, and so many of those games, people would just come flooding out onto the court. And I always thought, especially depending on shoes and their speed and the players exhausted, that something eventually was going to happen. Now, she was okay, but she really got run over pretty good. So I've never been a big fan of the court storming. I understand the fun, the excitement, the jubilation when you get a big victory, but, they don't do it in a lot of other sports, but because the court is right there, it's really tough to police and enforce, but I've never been a fan of it, to be honest.
Yeah, it really is tough to police and enforce because you have enough people to hold. Remember, they'd hold up the old ropes in our day, I think, to try to keep people off the court afterward. It's just hard to get enough people to police the whole thing. And then if you go, the other way with fines and things like that. So we'll see where it winds up this time. It's been a long debate out there with court storming, and we'll see as we come down the stretch of the big basketball games in February and March what goes on with that. But thanks again as a voice of reason always in Akron, Ray, and we'll see if we get a little bit more snow and we get these kids to be able to get out there a little bit more and enjoy a little of this winter weather with some boogie boarding and sled riding.
Joe, I thought the biggest story coming out of that court storming incident in Ohio was 18,000 people there to watch a women's basketball game between two good teams, Ohio State and Iowa. And boy, it talks about the prominence and the fans loving women's basketball. Women's softball has always been well received, really on the upswing. And you're seeing women's basketball being real popular at the college level.
That's part of why I brought it up. And I mean, and so a lot of times that is fueled by, one player who really everybody wants to see. And I just have heard at my office so many people wanting to see Caitlin Clark as she, in her career, is doing all kinds of great things and setting records. So she's maybe kind of the standard bearer that's leading that to some extent. And I loved it, too. It was great to see a full arena down at Columbus, Ohio.
I agree, Joe. Thank you, my friend. Always appreciate the time. We'll reconnect next week.
Okay, talk next week. See you, Ray.
Okay, there you go. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joins us Wednesday mornings on the show.